This episode, we'll be talking about the differences between osteoarthritis and rheumatoid arthritis. As earlier stated, arthritis is the inflammation of the joint space, meaning there are inflammatory markers in the joint. There are different things that causes erosion of the joint, and it presents with pain, swelling, warmth, and stiffness of the joint. Now, when we are looking at the differences between osteoarthritis and rheumatoid arthritis, we tend to look at the kinds of people that present, the age, and as well as so many other things that are added to those symptoms. Now, in osteoarthritis, what are the features that we would see? Patients would usually come complaining of morning stiffness lasting for about 30 minutes or less. 30 minutes or less. They complain when they wake up in the morning, they are unable to walk, they are unable to move the joints. And then as the day progresses, they are able to try to move the joint, but with some discomfort depending on how severe the pain is. They can also complain of joint swelling. They can complain of limited range of motion. Usually it's going to be affecting one joint. It's not always seen that both joints, that's on the right leg and left leg, or right knee and left knee, are affected. It's going to be on just different parts of one joint. Unlike rheumatoid arthritis that has even distribution of pain, that is, it can affect both joints at the same time, both hands at the same time. But osteoarthritis in this case will just affect one particular joint on one side. And usually in osteoarthritis, the thing is it's due to erosion of the joint over time. That is why it's more common in people who are advanced in age. That is not to say that some who are younger would not present with it, but things like overweight, when the joints bear too much weight, usually the knee joint, it erodes the joint, it makes it eat up over time, and then that begins this degenerative process. Then there are specific joints on the fingers that osteoarthritis can affect, such as the joints on this part of the finger. So some of the joints or all of the joints can also be affected on this particular part of the finger. Now, it occurs mainly in females as well. Females that are usually overweight would suffer more of this because during menopause, the strength of the bones begin to lessen, it begins to reduce, and this places more weight on those joints. Over time, the joint begins to erode until it is so severe that sometimes they may even need joint replacement or knee replacement surgery. So when a patient presents with these features in arthritis, we don't really need to do a lot of blood tests because it is clear what is presenting. What we advise them to do are things like X-ray. Then we tend to measure what exactly is wrong with them, and we tell them to use pain medications, and then over time we begin to monitor them and also tell them to do physio. The physio will increase the range of motion of the joints and ensure that they don't get stiffening or the stiffening doesn't get worse. Also, using knee brace has been advised, using pain balms that help to produce heat and reduce pain in the joints. The heat helps to increase blood flow so that function of the joints would be restored. So these are some of the things that we tell them to do. It's not an inflammatory process in osteoarthritis. For rheumatoid arthritis, the patient would present with morning stiffness and pain and warmth in the joint greater than 30 minutes. It could last up to an hour. The affection of the joints, like I had said before, are evenly distributed. It's going to affect the right knee, left knee, it can affect the elbow joint, it can affect the fingers, and usually the joints that are affected are this part of the fingers as well as this part. There could be destruction of the joint over time. It can affect the heart, it can affect the lungs, and these are extra joint effects. That is when we are looking at things happening outside the joint. It can be so bad that there is deformity that looks like the patient has had a fracture. And this is simply because, normally speaking, the white blood cells begin to destroy itself without any insult from outside. And usually we use blood tests to detect whatever is going on. It also occurs in people who are younger. It can also occur with osteoarthritis as well, because this is a lifelong degenerative process, destructive process of the joints. What are the blood tests that we may ask the patients to do? We can tell them to do a full blood count, rheumatoid factor, as well as a specific test known as anti-CCP. So when your doctor tells you to run these tests, they are very vital. Don't just throw them away and say, oh, the money is too much, or it's important that we get to know what is wrong with you. And these are, so I'm sure that right now many of you are just saying, this arthritis, can I treat it too? Or is this thing going to take away my life? The truth is, yes, you can treat it. Depending on the type of arthritis, and that is the truth, you can treat it. All forms of arthritis are treatable. However, some can be managed. For example, rheumatoid arthritis can be managed because it's an autoimmune process. When the white blood cells just out of nowhere begins to destroy itself by itself, this thing is as a result of a DNA error. And such things, you can't just treat it and it goes away, but you can manage it and live a fulfilling life. So there are some drugs that are used to treat rheumatoid arthritis. So it's very vital you check with your doctor, and it's also very vital that it is early enough. Early checkup is very vital to making a clear diagnosis. No be say una go sit down there, go dey pop pills, take drug, and be hoping, or those people that like to take herbs and go for joint whatever. Please don't do it. Meet your doctor. Meet your doctor for proper evaluation, so that by the time they diagnose you, you would know the next step and you would be treated, and whatever it is that's wrong will reduce. And follow up as well. It's important you follow up with your doctor. Thank you so much. On next episode, we'll talk more about different issues with your bones, your joints, whatever.